Imagine a pill that can make cancer cells destroy one of their own growth engines. That's essentially what VERITAC-2 studied. This trial looked at a new class of drug called a PROTAC in hormone-positive breast cancer. PROTAC stands for proteolysis targeting chimera, but think of it simply as a destroyer tag. Vepdegestrant attaches to the estrogen receptor in cancer cells and also to the cell's garbage disposal machinery or proteasomes. It basically drags the receptor into the trash, causing the cell to break it down. Without the estrogen receptor, the cancer cell loses a key driver it needs to grow. Fulvestrant, by comparison, also degrades the receptor, but less completely and requires an injection. The VERITAC-2 trial asked, could an oral PROTAC drug work even better than Fulvestrant, especially for cancers with certain mutations? This phase 3 trial compared a drug named Vepdegestrant, or ARV-471, to Fulvestrant in women with advanced ER-positive breast cancer. All patients had previously been on hormone therapy and a CDK4/6 inhibitor. Their cancer had progressed. Many of these cancers had developed mutations in the estrogen receptor gene, so-called ESR1 mutations, which can make them resistant to standard hormone treatment. The trial looked at outcomes both in patients whose tumors had ESR1 mutations and in the overall group. Patients whose tumors had an ESR1 mutation and who received the Vepdegestrant pill went significantly longer without cancer progression than those who got Fulvestrant injections. The improvement in progression-free survival was both statistically and clinically meaningful. Not a fluke, but a real benefit. In fact, the benefit was strong enough to exceed the trial's preset target in the mutant subgroup. However, when including all patients, those with and without the mutation, the trial did not show a clear advantage for the new drug. This suggests Vepdegestrant is especially helpful for cancers with that specific mutation. On the safety side, the new pill was generally well tolerated. Side effects like mild nausea, fatigue, and diarrhea were reported, but they were often manageable. Importantly, no new serious safety issues came up, and patients avoided the discomfort of injections by using a pill instead. In terms of clinical implications for patients and doctors, this trial could mark a shift in how we treat resistant hormone-positive breast cancer. If approved, Vepdegestrant could become the preferred option for patients with ESR1 mutations. It means no more painful muscle injections and possibly better cancer control. It also underscores the value of genomic testing. Knowing whether a tumor has an ESR1 mutation can guide the choice of therapy. More broadly, VERITAC-2 proves that the PROTAC approach can work in real patients, potentially opening the door to an entirely new class of cancer drugs. This adds a powerful tool to the treatment toolbox for a disease stage that can be challenging. For patients, it offers hope that even after becoming resistant to standard treatment, a new next-generation targeted therapy can step in to keep the cancer at bay longer.